Half of the body part stops working and that individual becomes incapable of saying even a single word when he has his brain hemorrhage because there is a compression on speech center. So if we were to handle this case ayurvedically, then we need to go to the basics, fundamentals. So there are three considerations. First, if we consider dhatu concept, then there is a saying that rasat stanyam tato raktam asrija kandara sira mansat vasat vacha satcha meda sahasnayu sambhavaha. Now, this Asrija Kandara Sira plays an important role over here. This Sira can be regarded as blood vessels through which blood flows. And the definition of Sira, according to Ayurveda, is Saranat Sira, a system through which something flows. It can be blood or lymphatic fluid, anything. So, if there is any kind of disruption in the flow, then there is a fault. Some malfunctioning is there, like there is a brain hemorrhage. So, now if you follow the reverse order of this shlok, this Sira is Ubdhatu of Rakt Dhatu, which means Rakt travels long trajectory to become Sira. So it means if there is any fault in Sira, then there is a fault in Rakta Dhatu. And also Rakta Dhatu and Pitta Dosh share Ashray relationship among themselves. So at last, Pitta is the sole entity which is responsible for disruption in Sira. That's why this Sira broke and blood oozed out. Brain and spinal cord, both of these entities are regarded as Majja. And Ayurvedically speaking, Pitta Dharakala eva Majja Dharakala, which means nature of Pitta and Majja are very similar. Now, Kala is a very thin membranous layer between Dhatu and its Ashay, which supports, protects, nourishes, and enables efficient functionality of that Dhatu. A technical concept, if you didn't get it, don't worry. So, according to this second consideration, Pitta and Majja, which is brain and spinal cord, both are similar, and any fault in this Majja Dhatu represents fault in Pitta Dhatu, Pitta Dosh. So, here also, Pitta is the sole entity which is responsible for this malfunction. Acharya Charak says pakshaghat virechana, which means virechan is to be done in case of paralysis, pakshaghat, which is very obvious if we assimilate the ideas of previous two considerations, where Pitta is solely responsible entity. So virechan is mandatory because bastir vireko vamana tatha tailam gritam madhu. For Vat, basti is to be done, for Pitta, virechan is to be done, and for Kaph, vaman is to be done. So go for virechan. And also look at the line of treatment which you can also follow with some permutation and combination, where Brahmi, Musta, Bringraj ka Siddh Tel is used for Shirodhara with some Shaman Aushadhis like Brihatvat Chintamani, Sahasraputi Abrak, Ekang Virras, Shringa Bhasma, Akik Bhasma, Praval Bhasma, Chop Chinyadi Churna, Ashwagandhadi Churna. Here Sahasraputi Abrak plays an important role. If you want me to make a separate video on it, how it works, then comment Sahasraputi Abrak. And in the line of treatment, there is one more thing which is Snehan and Svedan. And you can use many other medicines using Yukti Pariksha. Well, this is Dr. Hardik. I create content around health and authentic Ayurveda. If that's something that relates to you, then do check out my page and consider following. Till then, Jai Mata Di.